Hi there, I'm Dr. Kari Neemann. I am an assistant professor of pediatric and adult infectious disease, and I work here at Children's Hospital and Medical Center, and I also serve as a medical advisor to Douglas County Health Department. I get to work with patients with COVID-19 when they either come in with their acute infection and can help to advise on whether or not they need any antiviral medications that you may have heard about in the media. And then also get to see, unfortunately, the children who develop the multi-system inflammatory syndrome that occurs several weeks after the acute infection, and can try to help advise whether or not they have developed any secondary infections and try to help dampen that immune response that they're experiencing. One of the saddest things is seeing a patient in the hospital with acute COVID, knowing that there are things that we can do in our community to decrease that transmission. And so pediatric patients, I would say, have the benefit that we can allow at least up to 2 caretakers in the room with them, while when I see adults, they're on their own, and that is so sad. These patients are scared. They don't understand what's going on. And then we've got medical professionals coming in who, unfortunately, we have to gown up. We are wearing masks, we are wearing face shields, which we have to do. We don't want to infect any of our healthcare workers, but that can be really scary. These patients, they don't feel well. And while the majority of pediatric patients are going to come through COVID-19 with, fairly mild symptoms, there are those that we are seeing in the hospital who are severely ill, who end up in the ICU, who end up on ventilators and needing even bypass support. And so any infection that we can prevent, it seems we should always aim to do that, and that our community should be behind us. I would say all healthcare workers right now have the exact same amount of COVID fatigue that the community has. We're 10 months into this. We are tired of it. We don't want to see it, but we're going to be here for you. As a mom, it's been, I think, particularly hard. I have a 4-year-old son who at times has had to quarantine because COVID has been brought into his preschool, and trying to explain to him what that means. He, I think, is developing a little anxiety and likes to wear his mask everywhere, including our house. And one of his favorite questions for me is, "Mom, tell me the story of how COVID came here," which is awful. But we are going to keep him safe and hopefully keep our new one safe when she gets here as well. While it looks like we have 2 viable vaccine candidates that are going to make it out to the market, it's going to be months before that starts to have an impact. We need to start doing interventions now so that we can decrease our amount of hospitalizations and decrease the mortality that we're seeing in our community. I am tired of hearing the argument that this is an infection that only affects 1% of the population and will result in serious illness or death. 1% of Nebraska's population is 19,000 people. I don't want 19,000 people to die in this state. And so I would just plead that people please start doing these directed measures, if not for your own safety, for those around you.